My daughter's a nurse. She's just graduated. She's right now does travel nurses. So she sees different systems. Right now she's in Inuvik up north, which actually is a good situation for her. But in the city, what happens is that, they're totally understaffed. And what's changed from let's say 20 years ago when nurses were doing nursing care. Now there's so much administrative work to do, so much inputting. 50% of the time is spent inputting data, right, as opposed to patient care, and number of patients has increased. Right, so there's rather than acute patients, sometimes they're up to 7 acute patients, taking care of 7 acute patients at once, which is impossible, right? So again, that's why the attrition rate's so high. So people were aware but unaware, and I think what has happened with COVID is, the government has used the narrative of COVID as to why, we're lacking beds and why we need to cancel all these surgeries, right? So we were canceling surgeries before COVID. Okay. So this is nothing new. And what has happened, if you move forward in 2 years, is that unfortunately, because of what the government has done, what public health has done, is number one, surgeries were canceled initially. We were worried that this was going to be an event that was of extreme magnitude, and we didn't know. And so surgeries were canceled. But even when we realized that this was not as bad as it seemed to be, the narrative from the government was making people afraid, right? And physicians, number one, did not see patients. A lot of it was remote seeing patients remotely, and patients did not come in hospital when they needed to. Okay, so my husband, for example, is a surgeon, and he's seeing right now cancers that were treatable and now have become more palliative, right? They're advanced because patients weren't seen, and unfortunately in Canada, for you to be able to see a specialist, you need a referral from your GP, right? So, and certain things you need to be seen, right? So what that ended up doing is we're going to have an explosion of cancer cases, people that have not been treated in the last couple of years, and who knows what other reasons that the rates are higher.